Okay, good afternoon, everyone. Welcome back to the second part of this CTSI Research Bootcamp series. Dr. Laurie Theeke is our presenter. If you were not here for the first session on September 15th, that is available on the CTSI YouTube channel. And it was an introduction to writing a systematic review. So she's going to continue on with that today and looking at developing your clinical questions and planning for your systematic review. If we have partners joining us, we want to welcome you at our distant sites, Charleston, Marshall, Lewisburg, and anywhere else you might be. Just want to remind you to make sure that on your end that you do have your mics muted unless you specifically are wanting to ask a question, just so there's not a lot of feedback on the other end. But I'm going to go ahead and turn it over to Dr. Theeke.
Hello. Can everybody hear me okay? All right. So I'm not going to review what we did the last time except for like a little mini review. So the last time I lectured for about 30 minutes and we talked a lot about planning your systematic review and using specific tools to plan that review. And we ended with these are the overall objectives. Let me go over this real quick, I guess, of the lecture series. So first session was understand the process of the systematic review. The second is to get that clinical question down so you can move forward with your search strategy, because the question drives the review and the question drives your search strategy terms. Okay, so today we're going to focus on the clinical questions. So let me go down through these a little bit. We ended the last session with a review of the process of systematic review. Okay, so this was a slide from the last time, so get thinking about that again, this whole process that you're going to engage in. Okay, and really step one, and this is where we are, we're here, formulating our question. We're going to get through it all, but that's where we are today. So that's where our focus is today, is to think about what do you need to know about the topic that you're studying? What do you really need to know that's going to drive your program of research? So just get thinking in that mindset before we start today, because that's going to drive everything, and it should be foundational to your program, your overall program of research as a faculty scholar. Okay. So the last time we left it with this link, if you were not here, about the PRISMA P protocol, and this is a protocol put out by PRISMA, the preferred reporting mechanism for systematic reviews, that has very detailed items in it about how to write a plan for a systematic review paper. Okay, do you remember that? So a lot of you were here the last time. So when we left the last time, we were talking about figuring out, okay, who would do this work potentially with you? Did you have any funding to do the work? Thinking about doing that initial exploration of the literature and, what do you really need to know that's going to move your program forward? And then coming today maybe with some idea of a clinical question. I'm going to give you lots of information today and tools to develop a clinical question. And then at the end, I hope we have a little bit of time where if you want to come down, we'll put a couple questions up on the board even, and I'll give you some feedback on those questions before we leave today. Okay? All right. So this is the other thing we talked about, is once you write your plan, to register it with Prospero so that other people internationally know that you are writing this review and that we're not duplicating work. That's what Prospero is for, and we talked about that. Okay, so now we're on part two. Part two is about developing your clinical question. So today we're going to learn about all the different types of clinical questions for systematic review. We're going to learn specific domains, which is important for interprofessional knowledge here. If you're from a certain school or discipline, you want to think about what domain should your foreground question be in. I'm going to go over all those domains and subcategories of questions for systematic review. And then hopefully at the end you have some idea on a piece of paper about what your question might be, by the time we leave today, what your question is going to be that's going to drive your review. This is step one again, formulating your question. I want you to remember this. I'm going to go through a lot of information about questions. Most systematic reviews begin with a foreground question. So focus on that type of question today, a foreground question. In any single review, I don't want students in particular, some of my clinical doctoral students often get confused because they have a lot of questions, right? We all have a lot of questions. So, and then students have a lot of sub-questions. And it's common to have a lot of sub-questions, but that comes later when you're synthesizing your results. We need a super clean foreground question to work on developing your review. Okay. Okay, when you word your clinical question, I'm going to slow down for a minute. This is really the crucial piece of doing this work. You don't want to change it later, So, and I know that we do that sometimes as faculty and students. We think, well, I could change it later. I could always adapt it later depending on what I find in the literature. It's not really the right way to do this work. Your question comes from either background studies that you've done where you've identified significant gaps in knowledge about a certain topic, or it comes from a clinical experience. So like, I'll give you an example. When I first started, I studied loneliness in older people, and all people now, but it started with older people. And so for 15 years, I spent 15 years working in the 65 plus clinic as a clinician, nurse practitioner, seeing patients, and I started, for some reason, I thought I'm going to get this Ph.D. So when I went to get my Ph.D., I had faculty saying to me, well, what are you going to do? What are you going to study here? How are you going to move a program? You need a program. And there was a medical student there. I often precepted medical students, and so there was a medical student in clinic who said that I had like 600 of my patients, and he said, I can't help any of your people. I can't do anything for your people because they're all lonely. That's why they come to see you, because you listen to them, they're lonely, there's nothing else wrong. So I was so irritated. I just remember the day so clearly. I was so irritated. I had a senior professor saying, what are you going to study? And I had a med student irritating me, and I had a topic due. And so, I mean, that happened. So I was like, okay. But then after I got home, I just couldn't get that out of my head. I kept thinking like, he really might be right. Because I really liked a lot of my patients, and I liked to have them come frequently, and they liked to come, and we just had a good time together. And so we still do, actually. I like all of them. But then I started slowly reading just a general exploration of the literature, thinking like, maybe he's right. What is going on here? And then I started realizing like, oh my gosh, no one in nursing even studies this. No one in nursing studies this. No one does anything about it. We've been describing it for 50 years as a problem, and no one does anything about it. That's when you have your question. Then I started thinking about everything I knew about stress and pathophysiology and stress hormones and high blood pressure and inflammation, and I started thinking about, oh my gosh, what if these lonely people, that's why their blood pressure is never right? Because they're chronically enduring this smoldering stress, psychosocial stressor. And then, as I've done these studies over the last 10 years, like it's panning out, but that came from a clinical situation and some expert clinical knowledge about geriatrics, but also being open to hearing, problems in the clinic, being present with your patients, and really being open to hearing what is most meaningful or important to them. That's where you'll get a good burning question. Okay, so think about that, either from the literature or from your clinical experience. So the questions are classified as background, foreground, primary, and secondary, and I'm just going to get into some regular information for you here, okay? Okay, background questions, let me see. Yeah, background questions. Background questions are like these broad questions. They are general knowledge. They just ask for general information about a certain type of phenomenon. So like, I could come up to Tina here and I could say, well, Tina, like, what is the current treatment for cancer for this child, or something like that, and she would tell me, but she would get her information to answer my background question from a textbook or a current clinical guideline or up to date. The background questions can usually be answered by a textbook or other sources. These are not good questions for systematic review. They're too broad. There's a lot of information out there that's already been synthesized and put into clinical protocols and clinical guidelines. And so it is a type of question, but it's not generally the type of question that guides a systematic review. They're good questions, and we have to know the answers to them, but you're not going to be doing a background question, a big, broad background question, because if you try to do that, then you're really those are the kinds of questions that are answered by teams developing clinical protocols, or large interprofessional teams that are developing a Cochrane review that are commissioned to do that and have the time to do that. When you're in a faculty role or a teaching role or a student role, you've got to have a foreground question that's very specific to your program that is answerable. Okay, so foreground questions. These are less broad questions. They are very focused. We're looking for a specific piece of knowledge here on a foreground question. They have depth and dimension to them. Okay, they look at relationships often between phenomenon, patient, family, a specific disease state, exposure outcome, they look at more than general or universal evidence. Okay, they're really usually looking at results of one type of study, either quantitative studies or qualitative studies or something of that nature. So they lead to a review and oftentimes have a comparator in them. So you might be looking at, that's a different question I might be asking Tina. If I was going to ask her a foreground question about the same thing, I would be like, Tina, in children with cancer ages 6 to 12, is this drug better than that one in randomized trials? You see how specific that is? That's a very specific question that you could do a nice review on and figure that out. So it'll have your population intervention comparison. I'm going to go over each one of these formats for you, PICO, SPICE, and ECLIPSE. And often the foreground questions are categorized by domain. So you're going to ask a certain type of domain. The question I'm asking Tina right now is a treatment domain. Okay. So these are the domains of foreground questions. Okay, the first domain that we often look at in healthcare is diagnosis and screening. Okay, we often look at that. When we're looking at diagnosis and screening, what are we thinking about? Things like sensitivity and specificity of diagnostic tests, right? When we're thinking about screening, we're thinking about the same thing. We're also often thinking about cost compared to sensitivity and specificity of diagnostic tests. They often, when you're looking at screening, you look at prediction rules. So like if you're screening all these people for colon cancer, then how many people are actually, are positive, or is it worth it, or is it cost effective, or are you having improved outcomes? If you're screening all the women with mammograms, are you having improved outcomes? So those are these kinds of diagnosis screening type of questions. So if you're thinking about doing a review on that kind of question in the domain of diagnosis or screening, then you're probably going to be looking for quantitative studies that are randomized controlled trials to include in your review. And so to make this work manageable, remember we're doing search strategy next week because you have to have your question before we can design your strategy. But to make it manageable, you've got to have super tight inclusion and exclusion criteria. You want it to be very clean, and you want to be very clear on the types of studies that you're including, and you want to have a very good reason for that. So we will go over that either at the end today or next week. But we're going to talk about, remember, we talked a little bit last week about people saying, they can get buried in the literature or sometimes get overwhelmed with the literature. Being very concise at developing your question and then being very clear on your inclusion-exclusion criteria will help you to make it manageable and not be in that state of, there's too much literature here, I'll never get this review done and I won't be able to synthesize the findings. So, because if we looked at something here like, we'll talk about that in a minute, there's an example question up here. I put the references on here for you too with the title of these studies. So, if you're doing a certain kind of review here, you could pull that article, right? And you could look at that article and see how they did that review. So they're looking at comparative accuracy there of vaginal ultrasonography with some other types of testing and premenopausal women with uterine bleeding. So that's an example. Very specific, right? Even down to the population. We know they're all premenopausal women. They all have a certain condition. It's a very specific foreground question. So for causation and risk, where you're looking at the source of the problem, you're thinking, well, what causes this? What causes this? I've done some of that. What causes loneliness? What causes some type of illness or cancer or stroke? There's all these broad things you could look at. If you're interested in doing a review on that kind of topic, you'll have to really refine your population because sometimes that literature can get pretty big. So if you're looking at etiology, causation, or risk, you want to include quantitative studies, experimental or quasi-experimental design, cohort studies, and case controls. So as you're writing your methods section of your systematic review or your protocol for your systematic review, there's a methods section. So you're going to say in there, this is the foreground question. It falls in this domain. This is the types of studies I'm going to include because of the question you're trying to answer. You have to have an inclusion of studies that answer your question. Okay. So this is the third domain is therapy or therapeutic interventions or prevention. And you can write a nice review of outpatient, community, we talked about that, interventions with students, teaching strategies with students, different types of things like that. So just keep that in mind. But these types of studies are usually looking at, is the therapy effective? And if so, then what specific outcomes are you desiring to see? So that you could do that with like no comparator, or you might be thinking, is this therapy better than that therapy? And that'll be a question that'll have a comparator in it if you're trying to figure out which is better. Which often those reviews are, if you find a gap in that literature, then you could apply right for a comparative effectiveness study with maybe PICO or something. You know, there's other options for funding if you get that background information. If you get the information down in your systematic review and you can show a gap in the literature, then it could inform your next study design. So in those, you would want to include randomized trials, meta-analyses, and you might be able to find some comparative effectiveness ones if you're using a comparator. Okay. Fourth domain is prognosis or forecast. So you're trying to figure out what the prognosis will be for these certain group of people or patients with a certain condition. You're anticipating here. You're trying to understand, like I might be trying to understand, okay, what's the longevity and mortality rates for older adults who suffer from loneliness and still live in the community? That would be a very specific review that I could do. You know, what's the functional ability of women who have postpartum depression on their first pregnancy, things like that, at home with the baby, or caregiving ability or something like that. So those would be forecast. And then you want to look at longitudinal trials, prospective studies, and maybe some case control studies would be included in that as well. If they did, you know, you could have cross-sectional studies that did predictive analysis too, and then you could consider including those. Okay. Sometimes in healthcare, health sciences, and other fields too, we look at harm. And so you might be doing a review to think about what harm could this possibly do? What are the negative outcomes associated with a certain kind of condition, illness, treatment, intervention? It's important that we understand harm as well as good, right? So if you're doing a review of harm, you definitely want to include those randomized trials in that kind of a review. But also, and you can include single ones in there, non-randomized trials if they're observational but identify a specific aspect of harm. And then also, you might find some past systematic reviews if you're studying harm, because it's one of those things that we tend to focus on, you know, potential harm if we're doing randomized trials of drugs and things like that. So you might find some prior reviews that you'd want to include in your review. You want to have a section of the results of like these 5 past reviews have existed, and then what studies have come forward since the last review. Okay. So does anyone have any questions so far? Go ahead.
So for the diagnosis / screening domain, you mentioned that the best choice for the field is randomized clinical trials followed by cohorts followed by case control. What's the advantage in that?
Okay. That's a good question. I'm going to show you a slide. Very good. Well, what are we doing here? Why are we doing this work? Are you a student? Why are we doing this work? That's right. And where do we take the knowledge? That's right. So here, this is why. This is your evidence pyramid here. Okay? And so the highest form of evidence is really up here with like systematic review and meta-analysis, which is what you're going to develop, right? This is the highest form of evidence that informs clinical protocols, right? This is our evidence pyramid. So what we're saying is include these, then these, then these. Include all of them, because at the last session we talked about a good systematic review includes all of the evidence, but we want to have a really specific foreground question so you don't get overwhelmed. Okay, so that's why, because you want the best evidence to inform your conclusion section, your result and conclusion section. Okay? Mm-hmm.
I see you're talking about case controls and randomized clinical trials and cohorts.
Mm-hmm.
Just, is this for every principal investigator in the health sciences center, or the benchmark is something different? They may use something not related at all to these 3 things.
Yeah. So I see what you're saying. He's asking about, is this the same for bench work? You know, bench work is one of those things, it's really hard to take. We've seen that again and again with bench work in the Health Sciences Center. Like you're doing a fantastically, you know, really designed bench study, and then where people get stuck is like translating that to humans, right? It can be very difficult. So in a lot of bench work, there's like, maybe there'll be like, there's not always a two-group design. Sometimes it's initially a one-group design, or it's you're talking about just doing it with like tissue or blood or something. Stem cell research, yeah. So I would say that when it gets to human trials, you've got to look at the randomized controlled trials, right? But there's also going to be cases where you've had such experimental work that you don't have controls, right? You wouldn't have any controls. Like that's not my area, but I don't think you would have controls if you were doing some experimental stem cell. Is that right?
I don't know.
Yeah. Well, I would say in some cases for very experimental treatments, you might not have controls. But this is, if you can get this type of study, that's the best evidence. But always remember, we talked about this the last time too, that we can't ever predict what's going to be in the literature, right? I mean, we ask these really good questions and then you get out there and you can't find the type of study you want, or you can't find what you want to include, and then you have to adapt. And so, for example, I have a student that's trying to write about, it is essentially bench work with mice looking at brain cells or something. She's trying to mimic depression and see what the outcomes of depression are with these mice so that we can better treat people. And I'm trying to help her think about translating that to people. But she's probably just going to have a certain number of mice to work with and a limited number. And in the literature now, we're not finding where that's all being translated over. So I think if you're doing like bench work with stem cells, you might want to think about how you're going to word your question so that you're reviewing related studies. Do you see what I'm saying? Because when you're doing a synthesis of literature findings, I don't know if that helps you or not, because I'm totally a people person, but like I'm not a bencher, but if that helps you or not, but like you want to be really clear about your inclusion criteria, what kinds of studies you want to include that would move your work forward, in a way that's taking it to the path to translation. Yeah. So just thinking about, I don't know what kinds of literature's out there, and so I'd have to think about, and I don't know exactly what you're doing, but I have to think about, okay, what are you doing now? And then what kinds of studies would inform your future work? I'm not sure. I'm trying to help you, but I'm not sure. So, okay. Economic. So we don't have very many people in the Health Sciences Center doing economic work, but if you are doing a review that focuses on economics, these studies can be really hard to find sometimes because it's hard to predict economic burden or economic costs with some health conditions. And so you want to find studies that have those kinds of outcomes reported. And that's the key to that kind of a review. They're hard to find. For example, we were trying to find studies that showed, like, if we treated loneliness, could we prevent depression, which then would save healthcare dollars. Like, a lot of that is just on paper, right? It's not in good trials that I can give you hard numbers. And then meaning studies. Is anyone here doing a qualitative review? Okay, so we talked about that the last time. Qualitative research is when we're trying to enhance our understanding of a phenomenon. And you can synthesize findings from qualitative studies, but oftentimes they're very specific to the population experience or culture. And so it's hard to draw conclusions from qualitative work from a review of qualitative works because each study is generally a very specific population. But you can do it, and there is a tool to do it. I think Joanna Briggs Institute has a tool to extract qualitative data if you wanted to do that. This is a very good example of a qualitative review on parental experiences in the NICU. That's a high quality review there. Okay, so these are corresponding. I thought sometimes it's hard to think about, okay, well, I want to know this. What should I ask for the review? And so these are some examples of just corresponding background and foreground questions, just to show you how to take it from a background question to a foreground question, okay? So in the background, we might be saying, hey, what are some of these interventions for fall risk reduction in these community-dwelling older adults? That's very broad. You could probably just do a quick search and find that. But a better question would be, what are the specific outcomes associated with fall risk reduction interventions that have been implemented in the community settings of older adults? So it's much more specific. And then if I were going to set my inclusion criteria on this one, I would definitely only do studies that they had to measure fall risk. You know, they'd have to have older adults, and sample would have to be 65 and older. And I'd start thinking about, okay, how am I going to decide what studies to include in the review? And that question would give me some more specifics so that I could do a manageable review. All right, here's another one. We might say, okay, what is the normal body temperature and how it should be measured in children? We can find that in a textbook, right? That's a broad background question. So we don't need to do a review to find that. But a better question maybe would be, this is published a review, what educational interventions are effective and influence parents' ability to provide effective care for a febrile child? So it's really specific. Much more specific question that led to a nice publication for these authors on children with fever. Okay. You will see when you get out there, you're going to get, I don't want to have any confusion about primary and secondary questions, background and foreground questions. The primary question is really the foreground question. So if you're reading some literature and they say, well, my primary question is this, it's the same as a foreground question. And so I put an example up here that might be, for me, what's the current state of knowledge on loneliness? I'm writing this now in behavioral health outcomes for community dwelling older adults. So that is my specific foreground question on the review I'm writing now. I'm only including studies in that measure loneliness, and they have to measure a behavioral health outcome, and they have to have a sample of older adults, and the older adults have to be in the community. So it's going to be pretty tight, I think. The secondary questions that I have for myself, though, as I read and critique the literature, are questions specific to my program of research. So, you know, do these studies that talk about behavioral health problems report out a negative emotion? Or do they give us correlations or predictive stats on some specific psychological conditions? So that's an example of primary and secondary questions. But just remember, your primary question is the same as your foreground question, because those terms are used interchangeably in the systematic review development literature. And then you yourself will have, you'll have your own sub-questions based on where you want to move your program or what work you've already done. Because if you've already published some, say, primary reports of quantitative studies or other types of studies, qualitative studies, then you probably already have some questions about where you should go or what you should do next. And really, I don't know if you all, do you ever go back and read your publications? Because like sometimes I go back and I read my own publication and I forget what I said. You know, you forget what you said. And I also gave myself, like at the time, I was really in the zone, you know, and writing this paper and had all these good ideas and then went and did some teaching or something, and then I'll come back and I'll read it again and I'll be like, oh, I was going to do that. That was a good idea. I should have, you know, incorporated that, or I should think about that again, because one study informs the next one, informs the next one, and so that your scholarly program, you know, it's evident to people reading your work that like you're moving knowledge forward, that you're pushing it forward. Okay, so 3 basic frameworks for writing your question. And have you all heard of PICO? Everybody's heard of PICO, probably. There's some little tweaks to PICO here that I'm going to show you today. There's some new information on PICO, and then SPICE and ECLIPSE, okay? It's very useful to diagram your question. And using a framework to write your question just makes it a little bit easier, makes your life easier. So this is PICO. So PICO's been around for a long time. It's 1995. It originally was designed to answer therapy-type questions, and now it's acceptable to write a PICO-M, a PICO-S, or a PICO-T, okay? Because there's so much information out there. So you're going to identify your patient, population, problem, or phenomenon. You're going to identify your intervention, exposure, or risk factor. You're going to have a comparison or control sometimes. You don't have to. I'm going to give you some templates for question writing here at the end, too. Outcomes. And then maybe you're looking at a certain measure or method. Like I'm telling you, I find it very, it's a little bit easier to accomplish a systematic review if you're looking at a certain type of study or method. So I typically will write mine and say, this is a systematic review of quantitative studies. And I identify the methods I'm looking at up front so that people don't think it's a systematic review of all design studies. So you can limit by method how the problem has been studied or how the problem has been measured. Okay, I could do, for example, I could do a systematic review of loneliness as measured by the UCLA loneliness scale. I could pick a certain scale. You could pick a certain measure. And I could just review studies that all included that instrument. That's acceptable to do that because we have to be really careful drawing inferences across different measures and different instruments, right? Because they have different levels, different varying reliability and validity. So you can do it, but it might even be a little bit cleaner to pick a specific measure or method. Then study design time frame. So I had a student email me today that, I don't know if he's here, but he said it would be easier to do just look at 2 years. So, and I get this question all the time from my clinical doctoral students. And so I would say that if you want a very rigorous systematic review that gets cited frequently, because systematic reviews are some of the most cited papers, unless you have a very good reason, like just don't limit by time, because chances are if you have a very refined question, you will have a manageable amount of studies to look at. So don't go to the time first. Don't go to the time limitation first, because all that does is shortchange yourself, because you might miss some of that earlier key sort of seminal literature that you really need to read so that you are the expert on your program of research. So it's a good idea. I don't encourage limiting by time ever, actually. I think you should just read the studies. And the last thing you want is to submit your systematic review and say, well, what about this study that was done 10 years ago and you didn't include it and it should have been included. So then reviewers do know that. They'll find that. Or type of question and type of study there. So that's PICO. Okay. SPICE is a little bit different. SPICE is used in information sciences. So I don't know how many people here are like maybe dealing with some kind of a review about health records or any kind of technology, but SPICE is a framework that's used for information sciences to help with building questions, and it's usually setting, perspective, intervention, comparison, evaluation. So this might be something like, I have to think about this. This might be something like, in the 250 hospitals that are subscribers to the EPIC electronic health record, that's our setting, okay? Then we would have to do, I don't even know if I can do a perspective here. From the nurse's perspective, I could do something like that. Is this specific type of intervention or field compared to another one helpful? Okay, so, and then you could proceed from there. So. And then ECLIPSE, this is from 2002, and this is more for policy or management. So if you're doing a review of policy, you may want to use ECLIPSE as your framework to design your question. Okay. So one thing I suggest too is like just try to write your question and then analyze it using the different frameworks, and see if that's helpful to you. Sometimes it's helpful to analyze it with all, you could even do all three and see where you could take your work. And then the key terms in the question are going to drive your search criteria. Okay, so this is one of we're almost finished with the slides, but this is some templates for you about like if you're doing a certain type of question with or without a comparison. Okay, so you could kind of try to fill in those blanks and see if you could create your question. Okay, so that may be helpful to you. And I did give those slides out, so I think everybody here probably has a copy of the slides there, and it'll be, I think Megan has, or Julie has them too back there. All right, so that is it for the content for today. We have these two upcoming sessions where we're going to do searching the literature, and we're going to do thinking about getting this paper written with a good time schedule to finalize it for submission for publication. Okay. So does anyone have any questions, or does anyone want to try their question, or get some? I'm glad to give individual feedback if you have a question you think you want to study. Okay, sure, yeah. All right, remember this. I like to end with this. Check in with yourself every week, right? We're not going to live in that state of overwhelm. You're going to take time for self-care, do a reasonable writing schedule, and not, I got a few emails after the last one about deadlines for classes and how could they move things along a little bit quicker and things like that. And I'm going to say that, you know, marry the commitment and time, like we talked about, and then do your writing schedule and try to stay with it. I know some of you have deadlines for these review papers, but it's make sure you're budgeting your time.